Hello, everyone. My name is Joe Gura, and I'm a senior account executive with Carevoyant, a home care software developer located in Rolling Meadows, Illinois. Welcome to today's education session focusing on how to select the right software platform for private duty nursing agencies. The origins of private duty nursing. Private duty nursing has undergone quite a transformation since the late 19th or early 20th century. During that time, private duty nursing allowed for care one patient at a time. In some states today, this is still true. However, there are many states that allow a private duty nurse to care for multiple patients at the same time. The private duty nurse stayed at the patient's home and provided care for 24 hours, and nurses were hired and paid for by the patient. Early nursing schools trained the nurses mainly for private duty nursing. Private duty nursing has really evolved over a period of time to what it is today. The uniqueness of private duty nursing. Private duty nursing is different from your traditional home health as it requires skilled care for medically fragile patients. The care is typically provided in longer shifts from 8 to 12 hours and for a limited number of patients over a longer period of time. In the private duty nursing field, the nurse or LPN gets to know the patient as a person and can really become quite attached to their patient. The final point of the uniqueness of private duty nursing is that the care provided can be in multiple settings, such as the patient's home, at school, or even a group home setting. Next, I would like to highlight the unique challenges of private duty nursing. The first area of challenge in private duty nursing is scheduling. As you all know, scheduling in long hourly shifts poses many unique challenges not experienced in the traditional home health arena. Finding clinicians with the skills and availability that match a patient's needs can really be a struggle. Managing split shifts when care is provided in multiple settings and keeping schedules within authorized hours is also a unique challenge. And finally, managing overtime and keeping it under control while also keeping up with the constant changes in schedules can be extremely frustrating. The second area of challenge in private duty nursing centers on clinical documentation. Utilizing a software developed for visit-based documentation opens the door for inefficient documentation and patient care. Entering a long list of medications and keeping up with medication change orders also poses challenges. Preparing static flow sheets and medication administration history, as well as collecting vitals and measurements multiple times during the shift, poses many challenges. Private duty nursing also has the challenge of personalizing a patient's care flow sheets and requires communicating care changes to clinicians at the point of care. And finally, post-review of documents for missed medications, treatments, vitals, etc., can be time-consuming and stressful. The third area of challenge in private duty nursing centers on communication. Communication with clinicians and patients is vital. A HIPAA-compliant, secure communication method is key in assuring everyone is on the same page and that a record of these communications can be accessed at any time. Another challenge is real-time communication of medication and treatment changes, as well as real-time communication of care plan and care flow changes. Alerts for missed medications, treatments, vitals, and measurements is necessary in order to maintain your compliance. And finally, the ability to share messages and clinical documentation with the patient and the family can also be cumbersome. The fourth area of challenges in private duty nursing focuses on billing and authorization. Private duty nursing presents some very complex billing requirements for Medicaid and managed care. Keeping up with authorizations and scheduling within authorized hours is important to ensure compliance with your authorization. And finally, there is a significant challenge of manual effort to meet all billing requirements and effectively managing accounts receivables and collections. Now, let's take a look at some key features to look for in a private duty nursing software. The first area we will address are scheduling features. Ease of use is the key to effective scheduling, with the ability to be able to view all open shifts and available employees all in one screen. Being able to match employees by intelligently matching their skills and preferences with that of the patient. Having the ability to publish patient open shifts and shift offers to get a pool of available employees can help to significantly reduce uncovered shifts, thereby increasing revenue. Managing shift offers, overtime, and authorization limits is also a must in any private duty nursing software. And finally, schedule validations to minimize scheduling errors can prevent a lot of headaches. The second area we'll look at are some key clinical documentation features needed in private duty nursing software. First, being able to easily switch from documenting vitals, measurements, such as items like vent settings, seizure observation logs, output, etc., and medication administration is key. A clinician must have access to their schedules, a patient's clinical summary, and their prior clinical documentation in order to improve the quality of the patient's care. A clinician must also have the ability to personalize a patient's care flow sheet, as all patients do not require the same care. Medication and treatment changes must be reflected at the point of care and in real time. A private duty nursing software must provide dynamic, not static, medication and treatment records. A private duty nursing software must also provide real-time alerts for missed medications, vitals, and measurements. Effective communication between shifts to improve the quality of care is also very important, as is having the ability to easily print medication and treatment and administration history. And finally, a private duty nursing software must also be able to produce consolidated clinical documentation for billing. The third area we'll look at are some key communication features needed in private duty nursing software. The software should be able to provide you with HIPAA compliant tools to effectively communicate with employees and patients, and allow you to access the history of these communications at any time. Another key feature is to have real-time point of care and back office communication of medication changes and treatment administration. The software should provide real-time alerts for missed medications, vitals, and measurements, and real-time schedule monitoring for late start, early end, or missed treatments. The software should provide tools to communicate the plan from one shift to another. And finally, a family portal for families to view schedules and clinical documentation is a must-have in any software. The final area we'll look at are some key billing and authorization features needed in private duty nursing software. First, the software must be able to bill in 1500 or UB format based on the insurance, with the ability to send claims directly to Medicaid if needed. Linking authorizations to scheduling to keep schedules within the authorized hours and to keep you from billing for hours that are not authorized. A private duty nursing software must also have the ability to bill split shifts to different payers, and also allow an agency to set up claim validations based on individual payer requirements. It must also have flexibility to have the option of customizing claim formats for different payers that will aid in reducing manual efforts. And finally, a private duty nursing software must provide effective tools for an agency to efficiently manage their collections and accounts receivables. These are some of the key features a private duty nursing software should have for effective management of any private duty nursing home care agency.